Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas. Sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you to grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. It is just gone 9:30 on Monday morning here in Burrawang, New South Wales. And as you know, that's in Australia, east coast of Australia. It gives me great pleasure to welcome to the studio a dentist, part-time dentist, and also part-time educator of dentists and people in the health field on sales and marketing. Dr. Sugz Maha from Harrow, just outside of London, on the outskirts of London, in England, where it is 10:30 at night, Sunday night. So, Sugz, welcome to this Ultimate Dental Podcast studio. Great to have you.
Thanks so much for having me. I'm going to try my best to stay.
Yeah, sharp as a tack so far, and you know, so you should. You're not even half my age, so you should be wide awake. 10:30 would be my bedtime over there. But anyway, great to chat with you, and thanks for organising a time. It is hard, 11 hours time difference, but your profile struck a chord with me, and I've just got it over here. I'm just going to drag it over so I don't look like I'm looking sideways. Your profile on LinkedIn was really, really attractive to me because you help dentists and people in the health space, particularly the dental health space, on the art of conversion and communication in healthcare. And you're a conversion copywriter, but what I liked about it was that you're a disciple of Dan Kennedy. And as we were talking in the pre-chat, I've done a lot of Dan Kennedy work, and what we were talking about is that what is old is always relevant. It never goes out of date. I think it was Jim Rohn who said there are no new fundamentals. You know, the fundamentals of selling and the fundamentals of communication are the same. So let's talk about you. 31 years. You've not been a dentist 10 years, but you've obviously got a passion for marketing and selling. What do you see yourself? Do you see yourself as a sales guy who does a bit of dentistry on the side, or a dentist who does a bit of sales on the side? What's your passion?
I'd say my passion, funny enough, my passion is actually writing, and that's the funny part is writing was what got me into this rabbit hole of communication and sales and everything, and how I went down the whole copywriting rabbit hole in the first place. And I think what writing taught me was that the power of communication and the power of getting your ideas across. I think I realized that a lot of the fundamentals that I was learning through writing and organizing ideas and structuring ideas could be transferred directly over into dentistry. And I do fancy myself, I think it's funny, we were talking about it before, right? Like a lot of dentists put their clinical skills at the pinnacle of everything. You know, they do all the CPD courses in the world, they upskill and they fly across the world to get taught by these like gurus of composite veneers and aligners and implant dentistry. But communication is the one thing that they most dentists that I speak to, especially doing the work that I do now, have been on maybe one communication course in their entire career. I'm talking dentists who've been qualified for 10, 15 years. They might have done one, maybe two, and they call it quits. And I just think that doesn't make sense to me, because communication is probably the most important skill you can have as a dentist. Yet it's the one skill that we don't really look to sharpen.
Yeah, absolutely. Because how many dentists do you know, and you've met them, and I've probably met a whole pile more, who think the answer is, if I just get better at my clinical skills, then people are going to flood to see me. If I buy new equipment, people are going to flood to see me. But a good friend of mine who I met through this speaking business said to me, he said, you've got to be a better marketer of what you do than a doer of what you do. Otherwise, you'll go broke.
Yeah.
And so dentists need to know that, if you can't market yourself, and that means sell yourself or tell people why you are better and why what you do for them is going to give them a better result, what are they going to choose you on?
Yeah.
Price only. That's it.
Yeah. Yeah. Exactly. And that's how you end up with this kind of race to the bottom, and you end up with these clinics that are offering all sorts under the sun to try and get people through the door, because it's like, they don't trust their communication skills enough to be able to convert those patients. So it's like, what else can you do? Exactly what you said. Reduce your prices and hope people scrape through the door, and you get through on high volume. But is that the type of dentistry anyone wants to be doing? I don't know.
Well, high volume only works if there's profit in the volume. If you've got high volume and there's zero profit, or you're actually losing money, then you're just going to go broke quicker on high volume.
Yeah. Yeah.
I learned that at my age because I used to run big ads, successful ads in the Yellow Pages. Now, for anybody here who doesn't know what a Yellow Pages is, it's a book that used to have phone numbers for businesses in it. And there used to be two of them because it was only A to K and L to Z. And people used to look for businesses in this book. And there was no internet back in those days. So, but my point was that I'm monitored. And again, this is really important with marketing and sales, is you've got to monitor what's working and whether you can anticipate a trend. So I anticipated that my returns from Yellow Pages was diminishing. And so the year that I pulled out, I said to them, it's costing me $60,000 a year to run this ad. And that's 2 months profit. So I may as well just take the 2 months off and not worry about it, because I've still got the money from everything else that I'm doing that's in dentistry. It's just this Yellow Pages is going down. That year, I went from being third out of 17 Yellow Pages full page ads. The next year, there was only 5. So 12 pulled out. 12 pulled out. And a friend of mine who had the number 1 or number 2, he kept going for years and years because, I'm in second place, but soon he was second place out of 2. So you've got to monitor what you're doing. So again, test and measure is important. And that's a thing that a lot of people don't realize either in terms of marketing and writing. Now, you said you started off loving writing. Did you love writing ads, or were you writing stories, or were you writing articles, or were you writing novels?
If we start from when I was a child, it was stories, and then all the way through teenage life up until probably I was mid-20s, I was writing music, and I thought I was going to make it in music. Like, it went through dental school thinking dentistry was going to be a side hustle, to be honest with you. And I thought, music was going to be my primary thing, and then kind of fell out of love with music, and it transitioned into writing ads. This is where I'm at now, and who knows what that will transition into. I think writing has remained the constant since childhood, and what I write has changed throughout. So I can only imagine what that will grow into. But I fundamentally think that's like the skill that stuck with me.
So when you say writing music, were you writing the lyrics or you're writing the whole music stuff?
But both. So initially I was writing the lyrics, and I was a songwriter, and then got into production, and then I got into sound engineering, which was like the understanding the mix and the levels and stuff like that. And I got into that. And yeah, kind of learned the whole shebang. But that was out of necessity because I was a broke student and I couldn't afford studio time. So I was like, I need to learn how to do it all myself, because I can't afford to pay a studio £30 an hour or whatever it was back then.
Come on, the drummer from Queen, he was a dental student.
Was he?
Oh, yeah. Haven't you seen Bohemian Rhapsody? Like, he was a dental student. And Freddie comes along and Freddie says, I want to join your band. And they go, oh, we don't think so. And Freddie does his 4-octave thing, and then that's it. And Freddie kept saying right throughout the whole movie, he said, if it wasn't for me, you'd just be a rotten old dentist. And so he's one of the two. Not Brian May. What's it, Taylor or Deacon? I forget. But anyway, he was a dental student. So that could have been you. But music Music fascinates me. Like words I can work, but when you listen to these little bits of music in the background, you go, oh, how'd they do that? How'd they think of that? Just even that George Martin stuff from Sergeant Pepper's, and then Pink Floyd, that's real creativity. Yeah. If you can take that creativity from music and then put it back into your writing for good, for sales, to help people get what they want rather than people, because that's the biggest tragedy in sales. People want stuff, but they don't get it. And they
Yeah,
think they've done themselves a favor by missing out on it, but they've done themselves no favor, because the favor is when you get the stuff and it changes your life for whatever reason, be it, a food, be it a toy, be it a lifestyle choice, be it a holiday, be it a career choice. Sales is what life is all about. If we weren't selling ourselves, we wouldn't comb our hair in the morning, would we?
yeah, yeah.
And it's relationship skills as well. The stuff that when I was doing customer service in dentistry, once they learned that customer service in dentistry, they could not just leave that in the dental lot practice. That it impregnated their whole life, how they
Hmm.
interacted at shops, how they interacted with their family, with their children.
Yeah.
It's so powerful. So communication is the key. Tell me, in writing copy for sales, and I guess you're writing for ads as well as teaching people
Hmm.
how to be better at selling as well, what's your sweet spot? Where's your adrenaline rush when something that you do has a result? What are the things that you really enjoy saying that has been a great success for you because it has helped somebody else be successful at doing something else? What works best for you?
I think for me, so with copywriting, there's so many types of writers out there. Even within copywriting, you've got content writers and SEO and all this kind of stuff. And what I chose to kind of specialize in somewhat is direct response, which is going back to the guy we were talking about earlier, Dan Kennedy, who's one of the legends of direct response copywriting. And it's all about kind of obtaining the conversion, and it's basically getting a customer to take an action. And in my case, a lot of the copy that I was writing was landing pages and email sequences, email marketing, that kind of thing. And the best feeling ever was, the sweet spot for me was actually email. Like once someone introduced me to email, and this is why I've got my collective now, which are called Conversion Collective, and I've got my email list now, is the beauty of it is you build this unique relationship with a person because you're in their inbox. Probably, one of the most intimate places you can reach someone beyond SMS. I think SMS probably is the next rung up that ladder. And I found that when I could get emails to convert, that was the beauty, because you truly build it's almost like a parasocial relationship you build with that subscriber over time. And the funny thing is, it's a one-way relationship until the point that they click buy, or they take the action that you want them to do. You're building up to that point. So it could be it could be 2-3 weeks of sending emails to build up a launch of let's say a software or a new feature on a software. And you're building up that anticipation, you're building the emotion, and then you get to the launch, and then they click buy, and you see the conversion rate of the launch sequence, and you're like, wow, okay, this actually works. Like, you read all this stuff that the legendary copywriters like Eugene Schwartz and Dan Kennedy talk about when they were sending out postal, the direct sales letters in the post. And then you see it actually happen when you apply their lessons, and you're like, wow, this stuff actually works. So you read about it in books, but when you see it actually happen and you see people actually take action based on something that you've written, that's the sweet spot. That's the adrenaline rush.
Yeah, it's cool. Just in that, you reminded me of, because we all get more emails than we want, and some of them we just click straight off, but others, and I receive emails from, and two just sprung to mind straight away, and they're two completely different people. Mary Portis, who's a UK-based marketer, her stuff is great. I think she only sends it once a week, but when I get it, I want to read it all the way through. And
Yeah.
then another guy who worked for Dan Kennedy for many years, Dave D, who was a magician, went out on his own, and I did a bit of work with Dave as well, and he writes an email every day. And often it's just a little story, maybe with a tie back to something in sales or a lesson in sales. But sometimes, and to think, to set, like I was telling you, like I was writing 2 a week for 11 years. That's a lot of copy to be thinking of. But maybe my stuff was too long compared to Dave's. But Dave's is like, Dave, that's such a great story, and I never feel that he's telling the same thing over and over. Yet 365 days in a row, every year, there's always something new. He just picks one little tale, and it's only 4 or 5 paragraphs. So that is a real talent that you have to create that crescendo up to getting them to finally click the buy button. And of course, in today's day and age, that is a lost art because
Yeah.
so many people are after instant gratitude and entitlement. And if it's just like gone, you get one, you get, it's a scroll thing, isn't it? You just get one chance and that's it. So congratulations to you. Kennedy, a lesson that Kennedy, I often repeat it to clients, that I remember him saying, he said, he would write some stuff and then he would go to the client and say, all right, we've got 4 to choose from. Which one do you like? And the client would say, well, I like number 2. And they say, which one do you like, Dan? And Dan said, well, I like number 1. And they go, well, which one should we use? Dan said, well, let's just test all 4. And what they found was that every time the one that was the most popular was never the one that the client picked and never the one that Dan picked. It was always one of the others. So it's test and measure everything, test against one to the other. So again, what did Dan used to say? Slice and dice and psychographics and all sorts of stuff. Very, very technical for what we think, oh, that looks good. So definitely lots of lessons. So again, there's a patience in doing it, in getting it right. You also mentioned Halbert, who I never met, but I did have a copywriter who helped me in my early days as a coach, who was a big fan of Halbert and also Halbert was a very big fan of his as well. And so again, same thing, when I hired him, I was reading his emails and I go, he's writing to one person, only to me. When I read his emails, that's, again, he's right here talking to me face to face. So that's a real talent to be able to do that. Is that how you feel you write?
Yeah, exactly. It's funny. Everything you're saying is like, that's the adrenaline rush I feel. Like I get the rush from someone reading my email, because like you said, most people's inbox are filled with, let's say 5 to 10 minimum emails per day. And the fact that someone's taken the time. Yeah. Let's say the average person, the average person. And the fact that someone's taken the time out of their day to read through an email. I mean, that's a compliment in itself. I do find that is the true rush. It's just like, and that's a parallel with music actually, because, when you think about music, and when I was making music as well, I was competing with thousands and thousands of artists, and people can flick through Spotify if they get bored. They can listen to 30 seconds of a song, click onto the next artist, and that hours of work that you put into that song is now lost. And it's the same with email, where it's like, and with copy actually, you can put hours and hours into producing this copy that you think is going to be amazing and it's going to sell, it's going to sell like hotcakes. And then you put it out into the wild and it's like crickets. And it's exactly what you're saying. You need to test this stuff. It's A/B testing. The market's the only person that's going to be able to tell you what's working. Like it doesn't matter how great a copywriter you are or how great a salesman you are. The only correct person is the customer. So whatever they choose is the correct. Yeah.
So 2 questions. How do you reach the dental industry and dentists in particular? Is it a different sort of industry as opposed to other industries where people tend to consume more, buy more, and dentists can be very analytical by nature of their profession more than by nature of who they are?
Yeah.
I was a dentist for 35 years, but I never wanted to be a dentist. I was just expected to do something medical. And so dentistry was my second choice. And I just, back in those days, you just did what you got into and that you just made a go of it.
Yeah.
Now people drop out and start something in their 40s.
Yeah.
So how's that? Is dentistry a hard market to work in?
Yeah, I'd say so. So I'll speak from a perspective of a copywriter and running my agency first, and then I'll speak about my experiences as a communication strategist and talking to dentists about communication with patients. So when I'm speaking to dentists specifically, trying to offer my services in terms of ads or running their email campaigns or whatever, the number one thing I found difficult was that dentists, as you say, are very analytical. They need evidence-based knowledge for everything. And as you can probably imagine, especially when it comes to marketing, there are core principles and there's core fundamentals when it comes to psychology and behavioral science. But that doesn't mean that you can just apply it to everything and it's going to work automatically. So for example, when you're running ads for dentists, they expect ROI from day one. Whereas when you're working with, let's say, any other industry, actually, you work in tech, for example, and they're used to burning through ad spend for the first 3 months just testing. and they're used to that being money down the toilet. Like they will burn through 20K of ad budget just testing, because they understand that that's required to get to the sweet spot of eventually getting a good return on ad spend, etc. Whereas with dentists, and I don't know if that's because we work on quite tight margins, or the expectation of dentists is different. I don't know what it is, but dentists expect instant gratification, and they expect evidence based for everything, which just doesn't really exist when it comes to sales and marketing. It is so fundamentally about testing, and it's about applying things yourself and seeing what works and seeing what doesn't, and changing. And I don't think dentists are really open to that, because a lot of dentists are type A personalities. They're very logical, they're very left-brained, and they expect protocols for everything. And even when it comes to this communication stuff, the hardest thing that I encounter when I'm trying to explain communication to dentists especially, is they want scripts and they want protocols, and they want to know, well, if the patient says this, then what do I say next? And I'm like, it's not about what you say. It's not the words that you say. I could tell you what I say, but it's going to come across awful when you say it, and vice versa. I can't speak the way you speak. And this is the problem that I had when I was doing communication courses. I'm not going to name names, but when I did other communication courses, they were telling me stuff to say, and these magic questions or magic phrases that you say to patients that's going to get you 10 Invisalign cases by the end of the week. And it just doesn't work, because it doesn't come across the same way when I say it. And it might work in their hands, but it doesn't work in mine. So, that's the fundamental difference, I would say, is getting that across.
Yeah, it's tough. And I remember when I bought my first big Yellow Pages ad, I had to pay up front a year before the book came out. So the money's already spent and done. Then I've got to wait for the book to come out. Then I've got to wait for a year's worth of results. When the book comes out, I've got to buy the second year's ad, and I still haven't got the results from the first one. So it really was a leap of faith. But again, in my mind back then, what I knew was that the big ads were going to work, because you weren't allowed to do them as dentists. The ads came when the dental board in Australia relaxed, because everybody used to have the same font, same small writing. That was it. No bold, no nothing. And then they allowed dentists to put their own ads in. But what I'd already been doing was putting an ad. Dental companies could run big ads in dental emergency services. I had a quarter page ad in the dental emergency section, and I knew that told me that, because I was getting people say, I found you in the Yellow Pages. Well, I go, obviously they're just opening the book and looking for D, and then they see the ads. And so they weren't going to the index. Dentists are on page 792 and dental emergencies are on page 797. They weren't doing that. So again, it's just doing your research on that sort of thing. So I knew the ads would work. When they put them into dentists, that just meant more chance they're going to find those big ads as well. It's getting those results. But moving forward to the present day, Sugz, how does a dentist get their head around SEO and clicks? Because you can't go down to the grocery store with a wheelbarrow full of clicks and say, I'd like to buy some groceries. That's not a currency. You've got to have money. But the marketers talk in hits and clicks, and but it's sales that put money on and in my pocket and food on my table. How do we get over these phantom measures?
Well, I think with SEO, it's a slow burner. And I think that's what a lot of dentists don't quite understand. And especially now we're going into this era of LLMs and people now doing more AI search inquiries with Gemini and ChatGPT and Claude and whatnot. So now, with SEO, it's so much reliant on your reputation. It's reputation management, and building up your reputation online is quite challenging now, because it's not just a case of what it was, let's say 5-10 years ago, as you alluded to, writing blog articles and really trying to stuff keywords in and put dental emergencies in your local area and put that same keyword multiple times. And that used to work, but now the game's changed. And now, people haven't quite figured out how to get to the top of the AI game. And it's a constant wheel where you're like chasing the new trend. So I think going back to your question, I went off on a tangent there, but going back to your question, I think with SEO, dentists need to understand that, the fact that you've got to choose which game you want to play. You can either choose the paid ads game, and that will get you the more instant gratification and you'll get your leads in, but you've got to be prepared for the fact that you're going to burn through a lot more money going that route, but it works. Versus if you want to go down the SEO route, which actually is arguably, a lot cheaper actually. If you can manage it to become a lot cheaper if you do it, but it is going to be a lot more of a slow burner. But similarly, the fruits of your labor pay off, years down the line. You could keep producing articles on your website and optimizing your brand, and that will live forever. Versus paid ads, once you stop paying money to Zuck, that it's no longer paying off. You're not getting those leads anymore. So you got to decide which game you want to play.
It's interesting, and we're getting slightly off or I'm going to take you off your topic, but a friend of mine who's got a practice in a rural town in New South Wales in Australia had a 1-star Google review of his practice, which took him from being in the top 3 for the dentist near me search, which is the way he doesn't play in the ads. He doesn't play in the bottom. He plays in that dentist near me, the map. And it took him from the top 3 down to number 8. He persuaded the patient to remove the 1-star review, which they did. And within an hour of the removal, he rocketed from number 8 to number 1. And he asked me whether I knew of any of my clients who would like to experiment with their own and just put a fake 1-star review on and then get that removed to see whether it had the same rebound effect. Have you ever heard of something like that happening?
I've heard of similar kinds of things happening. I think nowadays Google are a lot more tighter on fake reviews, and especially a lot of these kind of. I think that the effect of the single 1-star review is far less than it used to be. Nowadays, there's services where you can actually, if you believe it's dishonest, but there's now dishonest reviews, and there's rival practices leaving reviews on other practices to try and bring them down, and all these kind of dirty games being played. And there's now services you can use to try and take those down. But I think ultimately, when it comes to that, I would advise a lot of practices, if you get that 1-star review and it's a genuine one, let's say, you could either go the route that your mate took, which is persuade the patient to take it down. That would be the most ideal result, but that's not always possible. Or you just drown that review with a bunch of 5 stars. You just work that bit harder to try and drown it out. And actually having that 1-star review, let's say you have 500 reviews and one of them's 1 star, you're still going to be 5 stars on Google. That's not going to take you down to 4.9. You'll still be 5 stars. It's only once you go above a certain threshold that you drop down to 4.5 or whatever it is. So depends how you want to play it, really.
All right, let's get back to dentistry and copy, because those are your passion. Thanks for that insight into the Google space for a short while. You mentioned that not only do you help dentists with their copy, but you also are helping dental companies with their copy that you write for them, and that you're working in some interesting biotechnical spaces at the moment. What out there is exciting you in terms of, I guess we're talking now, we're going clinical, but the fact that, when I started as a dentist back in the 80s, you weren't even born. People believed that the mouth was separate to the body. It was just something that was there and there was no communication whatsoever. Now we're seeing not only is the mouth a window to the body, but the mouth is also things that are going on in the mouth. We're now seeing like P. gingivalis is now playing a significant role in whether people have a predisposition or an early onset of dementia. So what are you seeing out there that's exciting in the oral health systemic connection?
Well, I'll answer that specific question, and then I'll go into what I find exciting in the dental industry as a whole, because it kind of links in. But I think I don't know if you've seen the episode of I don't actually watch it much, but Diary of a CEO with Stephen Bartlett, and there's a dentist from here, Victoria Sampson, who did an episode with him about the oral systemic effects, and kind of dementia was one of them that they mentioned. The diabetes, obviously, we know about, and that's obviously playing a massive role there. But actually, what I've grown to become very interested in is the application, and this is a bit cliche now, I guess, but the application of AI. I think there's so much exciting things going on with AI, and fortunately, with copywriting and the clients that I work with, a lot of them are in the dental space doing stuff with AI. And the beauty is that I get to trial out some of the stuff they're doing because I'm writing the copy for them. They're like, cool, you're a dentist. Why don't you play with it and see what works for you? Because, ideally we're trying to sell to your your friends. So, it's probably best for you to test it out and see what works and what doesn't work. So I get to test a lot of this stuff out. So, some of the stuff I'm playing with, these AI radiography tools that I'm using day to day. I'm using it in practice right now. I'm running bite wings and PAs through. There's a company I'm working with now called Diagnocat, which is basically runs it through the AI engine. It will diagnose the caries and any pathology that's on the X-ray, or shade it in. You can show it to the patient. So like before, I would be showing them a bite wing and trying to explain what's the grey splodge and the light grey splodge and what is the slightly darker black thing. What is that? That's the nerve. And you're kind of trying to piecemeal explain what's going on. And that's actually one of the things I wrote about on LinkedIn, which is, I remember being in second year and a professor showing me a pulp stone on a PA. I was like, I don't even. He was explaining what a pulp stone is and how it presents, and I was like, I don't even know where the pulp is. I don't know. I don't actually know what you're showing me, but he's going into all this explanation. And then now I realize, you're showing a patient an X-ray, assuming they understand where the tooth is and what you're talking about, but all they're seeing is just shades of grey. Like they have absolutely no idea if you're showing them the bone. You could be showing them a bone in a completely different part of the body, and they would know no better. So it's this AI stuff is really, really improving communication with patients, and it's interesting. There's so many facets to which AI is being applied both clinically and non-clinically, which that's the thing I'm most excited about.
Yeah, I know exactly what you mean about the 50 shades of grey on a radiograph.
Yeah.
Patient must look at us like we're nuts and saying, "Oh, look at this, you can see that." Yeah. I remember waking up after my first colonoscopy, and the doctor showed me photos of inside of me. It was all pink, and I'm going, "Oh, I've got a medical. I'm up the other end of the." I figure I've got some idea, but really it's just all pink. And I thought that's exactly what a patient sees when they see all those shades of grey. So I like the AI color coding of, and people understand red, yellow, green,
Yeah.
3 colors, red, yellow, green. Red is bad, green is good, yellow is good, careful.
Yeah.
And so let's just apply that to an X-ray and see what we can do. That's exciting. Are you doing any? Are you seeing any stuff in terms of you mentioned Victoria Sampson and the microbes in the mouth and how they then affect other parts of the body? Are you seeing anything exciting in that field? I know what excited me when we were talking about somebody I knew who was doing a lot of research in terms of an oral cancer screening test that showed whether from a saliva test, whether you were predisposed to oral cancer, as opposed to waiting for a lesion to be visible for a dentist to see. And then that's usually stage 3 or stage 4 and you're gone. May as well not have seen it, for all the good it's done for you. Anything in that sort of space in terms of helping people see things in the mouth that might be affecting other parts of their body?
I haven't been doing too much in-depth research in that. I mean, I've kind of watched that episode and I've seen some of the stuff that some of the dentists are doing here, like James Gornick, who's a dentist here. He's doing he's got his kind of clinic, which is very much holistic, and he does a lot of salivary testing and he tests a lot of biomarkers like vitamin levels and when they're placing implants, for example, testing platelets and all this kind of stuff. Is quite interesting in that regard. But I'm not very well versed in that side of things with regards to like the systemic effects. It's definitely something that I want to read about more, but it's not something I'm too clued up on, to be honest.
Yeah, it is an exciting part of dentistry to be working in, and I guess I'm a bit brutal with my clients when I tell them that you just got to keep telling your patients, that blood that's pumping through your infected gums is also the same blood that's pumping through your healthy heart, your healthy brain, your healthy lungs, and your baby. Let's get some emotion into what we're doing here rather than saying, it's all right. Do your gums bleed? Oh, I see your gums bleed. And then they just move on. Like you've asked them a question about their health. They've given you a red flag and you've just brushed it aside. That's getting back to teaching dentists how to sell their treatment, and it's the language. Let's get onto the language that dentists use, like softening language. It's a little crack. It's a small chip. It's just a clean.
Yeah.
No wonder their patients don't come back when they use this language all the time. Let's make it. I often say, I wish decay and dentistry killed people because then they might take it even more seriously. But still, people don't. I remember a doctor telling me that his patients used to say, "Can you refer me to another cardiologist because that guy wants to charge me a gap?" I think for heart surgery, like you
Yeah.
send them to the best heart surgeon you know, and they want to get a discount on their heart surgery.
Yeah.
How do we get over? How do we get over that? Let's get back into selling. How do we get over people who judge on price, or is there just always going to be people who are like that no matter what?
I do think there's a subset of patients that will make their decision based on price, and you just can't avoid that. That is always going to be a part of dentistry, and that's always going to be a part of human psychology. There's some patients that predominantly base their buying decisions on price, but I think fundamentally it's down to framing and what you anchor your pricing on. So for example, an interesting thing that I often come across is, so in the UK we have the NHS, which is the public health system here, and we place a lot of amalgam in the NHS, and a lot of dentists who are in NHS practices who want to do a lot more adhesive dentistry, composites and onlays and fancy stuff, the good stuff, the biomimetic stuff, they struggle to get that point across, because what they're doing is they're saying to a patient, look, you have two options. You can have a silver filling or a white filling. And if you're a patient and you're offered those two options, if I was a patient and I was offered those two options, I'm thinking it's the back of my mouth. So I don't really care what it looks like. So I'll go for a silver. Like I don't really, I don't mind. And that's the response. It's the automatic response you're going to get, because they don't understand the difference between amalgam and composite, and even actually going down to calling it a filling, right? Like one of my colleagues, Dr. Sunny, who he runs Dre Composite here with the Greater Curve, and he does a lot of work with restorative and stuff like that. He always says he refrains from calling fillings because he says fillings are what you put in a sandwich. It's not a filling. It's a reconstruction. It's a restoration. We're reconstructing your tooth that's been lost due to disease. We're having to do a full reconstruction of this tooth, and it's going to cost X amount. And I think that is a massive reframe, because ultimately a patient is always going to, if you mention filling, they're going to reference the filling they had 30 years ago with their NHS dentist, and it cost them, £15. When you're talking about your fancy white filling, which is going to cost them £300, they're like, okay, well, no, I'm okay, mate. Like, I'm not gonna pay that much for the same thing that I got, 15 years ago. So you kind of have to reframe what you're doing and add value to whatever it is you're doing. And that's the only way you're going to get people to stop making their decisions based on price.
Well, exactly. Years ago, I stopped using the word filling because patients wouldn't come back for fillings. What they will come back for is removal of active decay. And so, what's in there? It's active decay. Well, because even if you just say decay, they think it's static. So you say it's active, active. So got to remove that. And the filling is then the product that fills that takes the space. But people aren't going to come back, oh, you need 3 fillings. No, you've got 3 teeth with active decay. They go, I better come get that fixed. Again, it's that end result. And sometimes I think, you talked about, I think we talked about this before we hit the record button, about fixing broken teeth so that they never have to come back. Patients will do anything not to come back to a dentist, I found. I was gifted. My practice was 4 practices in the end. My neighbour's mine that I bought, then my neighbour next door, he sold me his, he came and worked for me for a year. He was a very good dentist, just regular dentistry. Then I got gifted a practice from a dentist around the corner who was retiring and couldn't sell it. And so he said, I'll bring you my filing cabinet, I'll put my phone into your switch. I said, what do you want for that? He said, nothing. Well, I tell you, that guy never did a crown in his life, but I saw 36 people from that practice, and many of them had, like, from premolars back, patches like you wouldn't believe. And I fixed those people's teeth. And I remember one guy saying to me, he said, I never thought I could chew like I can chew now. I never thought that would be a possibility. He said, my teeth feel so strong. And because this guy always just did patches because he thought that that's what everybody wanted. But there was a certain percentage of those people who wanted their teeth to last them. And so that was the lesson I learned from that, was offer people the best. It's up to them to then choose whether they want that or whether they don't. Now, that guy I described to you, you would not have thought that he could be the kind of person who would want 16 porcelain crowns. When you looked at him, he had long grey hair in a ponytail. He kind of looked like Catweasel, but with a little bit smarter than Catweasel. He was just a funny old guy. but he obviously valued his teeth and his ability to eat good food, and sometimes people don't understand that, Sugz. They think they can live without a tooth, but comes a time when you've got so many teeth missing that all of a sudden it's like a running race where you have a handicapped start. They have to go to dinner and start eating before their friends so they can all finish at the same time.
Yeah.
Because and people don't think, they never think about that. And so, when you mentioned that there's still people in the UK doing amalgams, I'm going, that's like 26 years since I put one in.
Yeah.
It's just wasn't happen, but it didn't happen. But I've always found the NHS like a merry-go-round. There's
Yeah.
always a patient leaving and going to the next dentist because they're not happy with this dentist, and then there's another patient coming from another dentist that they weren't happy with into that. It's like just a dreadful cycle. And so that sadly, that's what happens in any industry. If you put someone between the provider of a service and the receiver of a service, if any entity, whether it's a government, a health insurance company, superannuation fund, as soon as people can get their hands on somebody else's money in between, there's people trying to work it at both ends. The customer wants to get it for as cheap as possible, and the person providing wants to see if they can get as much money out of the system as they can. And that just bastardizes the relationship between me
Yeah.
and the guy mowing my lawns. No problem. There's nobody in between us. Between my wife and her nail lady, no problem. But as soon as we get that third party in there, and that's what the NHS has always been about. Sadly, it's just
Yeah. I mean, the thing is, it's fundamentally what I say to dentists is, I left the NHS last year for exactly the reason that you mentioned, which is I don't like having another entity dictating what I can do based on some contract that I signed. And basically, with the NHS, the worst part of it is they don't accept responsibility for the guidance they give you. So, for example, they will tell you as a clinician to do what's clinically necessary for a patient. What does that mean? That's so ambiguous that could mean anything to any number of dentists, right? So essentially, what that means, if you're paraphrasing that, that means as a clinician, you have the responsibility. You get paid what you get paid. You have the responsibility of doing whatever you do for the patient. So whether that's amalgam, if you want to lose money hand over fist and you want to do composites for no money at all, go ahead, do it. We're not telling you to provide amalgams, but do what you think is clinically necessary. So they don't want to accept that medico legal responsibility, and that's why dentists get themselves in a lot of hot water, because they're forced to work in this system with an intermediary that's dictating the type of treatment they can do, and it's not a pleasant system to work in. I couldn't see myself going back.
I'm glad you jumped out at a young age, because I don't think you'll regret that. From the dentists that I've met in the US, where it's third-party insurance companies that dictate the fees and the treatment, and they actually have to submit, dentists actually have to submit records and diagnoses to the companies, who then somebody who's not a dentist decides whether that's actually a valid treatment. That's crazy. In Australia, I found that a bean counter sitting in a harbour side office with a view of Sydney Harbour was deciding whether he was going to increase an insurance payment by 5 cents, multiples of 5 cents. And that made big differences to the insurance company, but meant nothing to the patient and nothing really to the dentist. And I thought, this was in the time when I stopped going to the bank for all my fees were set in multiples of $5 notes, because $2 and $1 were coins. I thought, I'm not carrying bags of coins back just to give people change. It's $5 notes. Sometimes you've just got to do things realistically. And so when they're when they're paying you in multiple of 5 cents, you couldn't even buy a box of matches. That was the cheapest thing was a box of matches. You couldn't buy a box of matches for less than 50 cents. So why do we allow those people to dictate to us what we're going to do for our patients? And so I learnt very quickly in setting my fees to set my fees based on the economics of the time. Again, back about when you were born, or maybe before you were born. We had inflation running at 28% for my business loan, 18% for my home loan. And so I was putting my fees up when inflation was 10%. I've just put my fees up 10% every year. Otherwise, I'm giving myself a pay cut. I didn't look at what my neighbours were charging. I said, this is what I've got to do to pay my staff. properly so they can live. And so over a period of 5 or 7 years, I was putting my fees up and most dentists weren't. And so my fees were way higher than my neighbours, but I never had patients. I never lost, if I put my fees up 10%, I never lost 10% of my patients. And so again, back to our old friend Dan Kennedy, who will tell you these 3 words: price is elastic. And so I learned that. And this is before Dan Kennedy. I thought, well, I lived that. Price is elastic. People will, if they value what you do and you provide them with more than just a filling, but you are giving them a service or a customer service or a relationship, they will love you. And the dentistry is just a byproduct. It's their health. You're actually giving them their health, but you're giving them a relationship. And so it's not about the price of a filling or the price of a denture or the price of a crown or the price of an extraction or the price of an x-ray. It's about the relationship and what comes more. And so again, in marketing, the reason people, if it was just about price, people would just be running ads on price. And some people do, but a lot of, that long copy that Kennedy and Halbert so beautifully put together is really what sells. It makes people feel inside.
That's it.
What's that classic ad from the 30s? They all laughed at me when I told them I
Playing
was
the
having
piano.
piano lessons, but
Yeah.
when I sat down and played ... How many times can you rewrite that ad in another industry? It's just,
Yeah.
it's a classic. So,
Yeah.
Sugz, I think we're close to running out of time. If anybody wants to, in the dental industry who's watching this, be they a dentist, somebody who works on the coalface, or somebody in the dental trade as well, how can they get in touch with you about helping them to get their message across better so that they can help their customers get what they need? What's the best way for them getting in touch with you?
Well, there's 2 ways. So if you want to get in touch with me directly and speak to me, LinkedIn is probably the best way. That's where I spend most of my time. That's where I post most and I'm most active. But if you want to get some free value and some free kind of expertise, I think the best thing to do is to join my email list, which is called the Conversion Collective. It's free. I send out 2 emails per week. I promise I am not selling things in these emails. It's purely, it's purely packed with value, purely packed with communication gems, stuff that I'm picking up, stuff that I'm reading. And essentially what I'm trying to do, and my mission really is to take a lot of these lessons that we've talked about today, David, especially with guys like Dan Kennedy, Eugene Schwartz, these legends. We're trying to take a lot of these lessons that these OGs, these legends have put together 50, 60 years ago. I'm trying to apply it to dentistry because psychology is psychology. It doesn't matter whether you're talking to a patient or you're talking to a customer in another industry, fundamentals remain the same. So I always think if we can apply those principles within dentistry, we can become so much better at communicating sales and communicating values. Yeah, long story short, best way to reach out to me, LinkedIn, or join my email list, which you can find hopefully in the notes of this, or you can find it on my LinkedIn as well.
All right. I was just checking there to see whether I'm not getting 2 emails a week from you, so I'm missing something. So I'm going to find out how I can get on the Conversion Collective myself. So I
Have you
can
have you have
more
you
of your
subscribed?
stuff.
Have you got the book?
I've got the book. Yeah, sorry, I have got the book. That's
That must be some tech. Either I'm in your junk, which is something that I'm doing wrong, or sometimes. Well, actually, that's an important thing that you brought up there. When you download the book, it's really important. You'll get a follow-up email that will ask you to confirm your subscription.
yes.
And the reason I do that is because otherwise it risks my domain getting blacklisted because some people will download the book not wanting to be added to the email list and they'll mark me as spam, and that will degrade my reputation as an email sender. So I do what's called a double opt-in.
Well, I must. And I'll have to go back in my emails because I downloaded that book last year, I think, before I had my surgery on my foot. So,
Oh, wow. Yeah,
So if not, you can opt me in. But anyway,
absolutely.
Sugz, thank you very much for being a guest today or tonight, your time on the Ultimate Dental Podcast. You've shared a lot of good information, and I hope for our listeners here on the Ultimate Dental Podcast that they reach out to you, because just between you and me, dentists definitely need help with how they communicate to their patients, because there's a lot of patients walking out of dental offices without getting the treatment that they need because it hasn't been communicated to them the benefits of what they're going to get. Again, Sugz, thanks so much for being with us tonight on the Ultimate Dental Podcast.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favourite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.